Hi, my name is Kate Mason, and this is the second video in a series on social impact bonds. So I'm talking today to Taschi from Taschi Talks. She has a channel on Rumble unpacking social impact bonds and how its relevancy to Australia. So today we're just going to do a bit more of a conversation regarding this on the ideology behind social impact bonds and some of the implications that both Taschi and I can see, the concerning implications. So I have a very long background in welfare and worked with families and children and youth for many, many years. And Taschi has a background in data. So we both see things from different angles, but we hold similar concerns regarding the model of social impact bonds.
Yeah, hi, Kate. Thank you for that. Yeah, we do hold similar concerns, and I'm very appreciative of the opportunity to talk through some of them with you. It's not just you and me, though, that have got some concerns. There are other people starting to what they've called here wising up to the impact scam. This is written by Paul Kudenek from winteroak.org.uk, and I won't read the whole thing out, but he does say that capital is today seeking sustainability by expanding into the virtual world, creating new markets from which to profit. Now, he's describing something that we've attempted to describe before, which is the data collection on people's lives and the model around impact investing. Now, I'm going to cover some of the stuff that he talks about in this talk with you. At the end, he mentions, but how can they track all this? And this is where my data background comes in. It says, how can anyone know how the child is advancing, what kind of social relationships she is enjoying, what she is eating, and how her body is doing? Total surveillance is required, and total surveillance means the internet powered by 5G or 6G. If the infant is constantly plugged into the matrix, interacting with artificial intelligence, diligently entering data about herself into the machine, then the investors have the evidence they need of how she is advancing or not. And as you can see on the right-hand side of the screen, I've got the definition of impact. It's to impinge upon, especially forcefully. Let's break that down a bit. I've listed this from Rockefeller Philanthropy Advisors, and it talks about what is impact investing. And impact investing seeks to generate social benefits while delivering a financial return. And it's expanding as a promising tool for both investors and philanthropists. Some estimates value the current impact investing market at nearly $9 trillion in the US alone. And what he says here is something I want to discuss. It says, as the problems societies face become more entrenched and complex, he says it's clear that government can't solve them on their own. This is where we have public-private partnerships, and they're looking for a 1% shift in global capital markets towards impact investing, right? Saying that this works towards social good. And they're saying that there's an outstanding 2.5 trillion annual funding gap to achieve the United Nations Sustainable Development Goals. This is my view on sustainability, and it's just my opinion. But sustainability, okay, sustainable is a term often used to describe practices, processes, or systems that can be maintained or continued over the long term. Now, what that means is, I think for them, is that they want to be able to sustain their profit ad infinitum. But in a finite resource-based economic model, your profits will dwindle as your resources dwindle. And that is their argument, that they don't want to keep, raping the planet and using the resources. So in order to maintain their profits, if they switch to an economic model that makes money from societal problems, well, then you can keep going. That is sustainable, right?
Yes, and I just wanted to add in here without going too much further into it, but I think it'd be good to unpack this in a future episode that you and I do. Rockefeller funds the Wellbeing Economy Alliance. That is about a new way, a new economy, and how the economy is changing and what it measures. And so we're looking at potentially this Wellbeing Alliance and hearing the framing of wellbeing over and over again, including in Chalmers' wellbeing budget, the Treasurer of Australia. So I think it's something to keep an eye out for, the connection point.
Yeah, I agree, because it talks about well-being of people. Now, if I consider the ideology of impact investing, it really depends on whether you view individuals as a burden or as a gift. Now, I'm using here an example. I was in Perth recently, and in the West Australian, they had an article, says school domestic violence lessons, how we stop this kid from becoming a monster. Now, social impact investing is all around risk mitigation. And what I mean by that is it's mitigating the social risk of you potentially becoming the worst person you could possibly be, and therefore a cost on society, right? So what we'll often hear, especially around well-being and in schools, is we often hear about children reaching their full potential. But the programs that the impact investors, the social impact investors, they're not actually aimed at enhancing any child's full potential. And I'll give an example here of, say, free extra music programs for someone who's showing signs or interest in music. That's not their interventions. They invest in interventions that stop you becoming the worst you can potentially be. So this child could become a monster. Now,
Yes.
who gets to decide what someone's potential is anyway? And why is it increasingly viewed purely in economic terms?
And that's a really intense headline, isn't it? How do we stop this kid becoming a monster? It's the assumption that the child will become a monster unless some intervention occurs. And then it raises questions of, well, so how long do you follow this child until it, becomes a man? At what age would you then determine that program stopped him from beating up his partner or a woman? So how would they actually be able to even cost that and pay themselves for that?
Agree. And that's what I'll talk about. I mean, the idea that we view one another as the worst isn't really a society I think we should encourage. I think we should be viewing each other as the best. You bring out the best in someone when you see the best in someone, and recognize the best in someone. And this seems to be the opposite.
And it's an
What
assumption.
we also
It's an assumption. Sorry to interrupt. It's an assumption that, as you just said, that rather than enhancing, a child's gifts or something they love, you have to come in hard and strong to stop them being something that's inherently, inside of them, rather than,
well,
let's give this child a better life and, help this child become the best of who they can be.
that's right. It assumes the worst. It's all worst case scenario planning, but I don't think that makes things better. That's my view. So one of the other things, and I'll continue on the vein of this about addressing domestic violence, right? Now, I'm not going to talk about any particular bonds. I'm just talking about the ideology here, and some of the inconsistencies or the ironies that I see in that, we're constantly told, do the right thing. This is neuro-linguistic programming that we've heard over and over again over the last 3 years or so. Do the right thing. And yet, when it comes to implementing any type of policy, it's justified in economic terms. So on the left here, I've got off the internet, according to the Department of Social Services, domestic violence will cost 13.6 billion a year, and it says here the cost of domestic violence in Australia was estimated at 8.1 billion. The costs associated with healthcare spending, 11,000, criminal behaviour, 14,000, and loss of labour market productivity, 26,000, is 50,000 per person from the ages of 20 to 64 as a result of being exposed to domestic violence as a child, is 50,000, right? So what they've done is they've broken aggregate numbers down and assigned it to an individual level so that they can then use that to cost up why they should do the right thing. It's no longer doing the right thing because it is the right thing, or the moral thing to do. It has to be costed. And a return on investment is made to the investors on a percentage of the savings they've created in the long term.
Yeah. And this is what, when, I talked about in the first video that we did, but this is when I was working in welfare, or I was working in the community development space when they started all the lockdowns. And so the domestic violence went through the roof, with lockdowns, because you're putting a huge amount of pressure on families and people financially. There was a big divide between who would have had a really difficult time being locked down compared to those who didn't have a difficult time. So if you had a big house, you had a backyard, you had space and money for, to be able to do things with your children inside the home, compared to somebody who's stuck in the inner city in a housing commission flat or in some sort of apartment where you're only allowed outside for 1 hour a day and you're not allowed to go to work and you've lost your, your work, etc. The pressures that then that puts on leads to domestic violence. And they know that. They knew that.
Of course they do. They know that. They know the stressors. And we'll come to it. I've got a slide on that at the end. They know exactly the stressors on society. We'll come to it. Absolutely. So your question was, well, how do they measure that then? So I looked up a number of articles around how can you actually prove this? And so there's a paper here from the Stanford Social Innovation Review, how impact investors actually measure impact. And so I read this, and it's quite detailed. So I'm only going to cover this at a very high level, but they've come up with all these kind of cool algorithms or what have you, calculations. So there's something called an SROI, social return on investment, and they use things called an IMM, an impact multiple of money, for a cost benefit ratio. These are calculations, but they are essentially built into what they call logic models. And these logic models are used to identify assumptions in an interventions theory of change. So what we're looking at here is assumptions in a theory, right? We're not in reality anymore. We're in assumptions in a theory. I'll give an example, the assumptions that a person will reoffend, if we're talking about recidivism rates or something like that. Essentially, this is investors making assumptions about you and your life trajectory. Now, I don't know about you, but I don't want investors making assumptions about mine. They also say that they use quasi-experimental and experimental methods. I hate to draw the analogy, but we've used experimental and experimental things over the last 3 years, and the outcome isn't very good. And they also use what they call randomized control trials. Now, each of those has complicated numbers and what have you behind them. The point that I want to make is that, and I've put it in red here in the corner, is if these interventions, which they say they are being used to solve societal issues, then the measure should be at the societal level. So what we should see is a projection for mental health rates declining. We should see hospital requirements declining. I mean, really, we should see decommissioning of mental health clinics because we don't need them anymore, right? We've fixed everyone. We should see educational attainment improving. And these are the things that we should be measuring. But the measures, those ones that I've put on the right there, they are measures at an individual and individual program level. They are not aggregated up. So you can see on the domestic violence example I gave on the previous slide, they've taken an aggregate figure and they've narrowed it down through modeling to an individual level. Then they implement the program and then measure them at, or claim to measure them at individual level, but they don't aggregate it back up to the societal level that it's supposed to fix.
Yes. So does
that make sense?
Yes. The assumption is the individual is the problem, and that it's not the society that needs, looking at as to why so many people are having trouble. So it becomes an individualized fix you under some sort of, whatever model they've brought up and they think is going to fix a person, an individual, according to how they see individuals need to function in society, rather than looking at what makes people, happy and okay and thrive within a society. What are the conditions within a society that need to happen and be encouraged? And they are, and if we just talk about mental health, so just quickly, the World Economic Forum has said the cost of mental health conditions is projected to rise to $6 trillion globally by 2030. And that's up from 2.5 trillion in 2010. So another 4 trillion or 3.5 trillion.
Exactly. So if they're fixing it, why is it projected to get worse? How is this a sustainable model for them? If they're going to fix all these problems, how is it really a sustainable one? Because if they actually fix all these problems, then they wouldn't have anything left to invest in because everything would be rosy and lovely. But that's not the case. All the projections go up. They keep telling you these problems are entrenched. They're not actually going to fix anything. They're just, as you say, they're focusing on individuals and making money off of individual interventions. So let's look at that a bit. As you said, I come from data. So what they do is they use predictive analytics on data sets, human data sets. And I found, again, a paper that talks about a kilo of impact. And let's break this down. On the left-hand side here, on the top, I've got off the internet about normal stock market, right? The phrase past performance is not indicative of future is often used in the financial industry to remind investors that past returns are not a reliable guide to future performance, right? That's from the SEC. Stock market analysis, they say that past returns are not a reliable guide to future performance. But when it comes to social impact investing, oh, it is. So here they say, and this is in the red box in the bottom left, put simply, instead of presuming the correlation between outcomes and long-term impact, predictive impact analysis uses validated research to quantify the value of an intervention in concise monetary terms. The objective of the entire exercise is a monetary figure that can compare apples and oranges, what we jokingly call a kilo of impact. What they're saying there, predictive analysis only goes off the past. Otherwise, it's just woo-woo, right? So what they're saying there is that, well, when it comes to social impact investing, human data sets are used to predict and quantify future performance. They are a reliable data set. Normal market, you can't use past performance. When it comes to human impact investing, you can use past performance. That's basically what they're saying.
Human data sets, is that a way of saying, okay, this is someone's socioeconomic background, the amount of money their family makes, any mental health interventions, everything. So is this how you're reading it? That it's all these data collection points that they have get put together to show what a human being is, and then they predict.
Yes.
They predict the performance of that person or that child based on a number of factors of data points they've collected about that family and that child.
Yes. And that's why they collect data like that. Increasingly at schools that they're asked, what's the educational attainment of your parent? Because they say that they can predict the outcome of the child based on the parental education. But that doesn't always hold true. My mother didn't have any qualifications at all.
No, and I don't know
I'm
how
quite
many parents, I don't know how many parents are aware that all the data, because there's a lot of data collection points and more coming up in the schools, including the Wellbeing Survey in New South Wales, where children rate, which I talked about in the first video, they rate, I think it's 1 to 5 or 1 to 10 regarding how happy they are with their finances and the things they own and all this stuff. I'm not sure how many parents are aware of. Once you see it, you start to see how much is coming through the schools in terms of collecting data on children and their families.
Yeah, there's a lot of data being collected. And this is what the reason why it's being collected, so that they can feed it into these analysis models, social return on investment, impact multiplier, so that they can jokingly develop a kilo of impact.
And that's really relevant because I think, and I might be wrong, but I think within welfare, those data points were collected in a more generalized way. So it was like, so it was a more general structure around, this plus this plus this might lead to a worse outcome for a child. So let's do some interventions regarding certain things. But now we're coming down to where it's individually, that child is a commodity. That individual child is a commodity, not just to sort of, okay, we need more services in this area because this is what's showing up through data.
That's right.
So it's targeted to, your own individual child has a whole system of data around them, which then is being potentially used for investment.
Yes, that's right. And then I'll show you, or this is my view again, on how they do this. I'm making the comparison between prospecting for gold and prospecting for customers or clients or problems, right? I see that there's a number of ways that they can do this, right? Well, you can create the problems, and one of the ones I looked at recently was around climate stress. So not actual climate stress, sorry, like anxiety in children around their worries, because they're consistently taught in the schools that the world is boiling and the world is going to end and they're all going to die, everything is going to become extinct. Well, they teach this in the schools, and then they measure the level of climate anxiety and mental health problems in the youth. Then they write reports on it. Origin wrote a report on it recently, and then came up with some recommendations. Well, not one of the recommendations was stop teaching this in the schools. It was all around more intervention
Mm.
and more stuff online. Let's talk about your feelings online around your climate anxiety. Not the sensible thing, because even if you believe that climate boiling point or whatever you want to call it is real, there's really not much a 12-year-old can do about it. So just concentrate on teaching them critical thinking skills so that should they grow up and be concerned about the climate, they are well equipped to think then about something that might be tangible that they can do. But that's not what they're doing. They are creating the problems. That's my number one bullet point. They're creating problems. The other thing they can do is remove the stigma so that people self-identify as having a problem. And in fact, this has been going on for, I think, decades now. There used to be stigma around suicide, for example. And there were studies that shown the more you talk about it, the more it happens. There's an element of social contagion. But over the last few decades, we've removed the stigma around many things that are problems. And then if people can self-identify, then they basically, enter themselves as a market entrant into the social impact
Bonds. And
investing
that was
economy.
done very, very heavily in the mental health field I'd say over the last 10 years, around remove stigma from mental health. And mental health very much sees people, for the main part, it pathologizes people into, having anxiety, having depression, it's just become increasingly as though they have this disorder without an unpacking of what's happening in the person's life. Regarding why they might be distressed. So it's a particular lens, and that mental health of, destigmatizing and framing mental health rather than when you actually are really, concerned about something, finding a trusted person to speak to who can help you make sense of what's happening in your life and why you might be having the feelings you have is very different to seeing someone with a diagnosis. And then that leads to, mostly it leads to medicating, and then more and more sort of, I don't know, meditation or self-help sort of stuff, rather than an actual what's happening in your life, what's going on.
That's right. Now, one of the other things that they do, and I think you'll have something to say around this, is actually removing help unless people identify. There are people with very active children who don't like sitting down for, 4 hours a day, or very smart children. And instead of giving them extension work, they are classifying them as disruptive, or saying, well, we'll get you the help, but only if you, admit that your child's on the spectrum or something like that.
Yeah, that's very much happened in the welfare field, I think, over the years as well. It's become more about this early identification, getting in early to help people with their problems, but then they need to have, it's gone less and less just a person, like being funding to actually just assist people and have a space where people can talk, to one where it's become about having to have diagnoses or get them, this specialized care over there and this specialized care over there. Yeah, it's changing the way we see, it's changing humanity. It's changing what it means to be human, basically, and the sort of help you give.
That's right. Everything needs to be categorized, identified, measured, and managed, and monetized. That's basically what this is. Another way they prospect for gold or get their customers is to call out others. We get a lot in the corporate world now. We get like bystander training. If you see someone else behaving in a wrong way, call it out. Don't be a bystander. Now, there is a place for this. I agree, but on the other hand, it's all about reporting out others, and often reporting to a third party. Now, the example I'll give to this is I saw There's actually a massive impact investing economy around loneliness. And I saw some program, I can't recall it now, but it said, if you have a neighbor and you notice that their curtains haven't opened for some time, you can report it to the council, who can send someone round to help them. It didn't say go and knock on their door and see if they're okay. It's all about reporting to a third party. And they also have like dobbing networks now. If you think the family next door are having problems, then you should report it. Don't go around and speak to them first. Another one is around universal screening for problems. And this can be physical health. You see it in physical health. There's I think a prostate exam that they give to everyone when they turn 50, but increasingly they're doing this in the mental health arena with children. And in fact, Australia's Productivity Commission's inquiry into mental health suggested mental health screening for children under 5. That's the Productivity Commission. Like what have children under 5 got to do with the productivity? Do you know what I mean?
I do know what you mean, but it is very productive getting these children. So Pfizer gave away for free the tool to diagnose children with depression, to diagnose people with depression. So that's the tool that doctors in Australia, and I don't know how many other countries around the world, use to decide whether or not someone's got depression, is supplied from Pfizer. Now, Pfizer, of course, is heavily involved in antidepressants. The mental health realm, there is conflicts of interest all the way through it. So ADHD in children is just exploded. And in America, with the children just returning to school, just recently, the ADHD drug market was stretched thin with children returning to school. And so children were taken off the ADHD meds for school holidays. And when they go back to school, they're put back on it. So you're managing these children through drugs rather than helping them to, looking at why school's such a difficult experience for so many children these days and what's happening to people and families. And the other thing that happened in Australia around ADHD was at the end of 2022, a new Australian ADHD guidelines was released. The taxpayers gave $1.5 million to the Australian ADHD Professionals Association to write this report. And this association, it's called AADPA, has yearly conferences funded by pharmaceutical companies who make ADHD drugs. And the president and founder, I'm not sure if he is at the moment, but he was at the end of last year, of the AADPA, was also instrumental in writing the report. This report, the ADHD report, has received grants from pharmaceutical companies that make ADHD drugs and given talks, educational talks, also sponsored by other pharmaceutical companies who make the ADHD drugs. And in this report, it calls for organisations who provide services to people from high-risk groups to systematically screen for ADHD. This is children with anxiety, out-of-home care, foster care children, any child that's been already diagnosed with a mental health issue, autistic, intellectual disability, low birth weight, sleep disorders, etc. So even sleep disorders is then, then those children need to be screened for ADHD. There are actually no laboratory tests that have been established as diagnostic in the clinical assessment of ADHD. Signs of this disorder may be minimal or absent when the person is receiving, this is how they talk. So there may not even be signs of it because they're getting frequent rewards for appropriate behavior. So, when they're going to somebody seeing them, they mightn't actually show any symptoms because, they're enjoying being in this doctor's surgery. And so they present as perfectly fine. There are no specific physical features associated with ADHD. So it's incredibly arbitrary. And already the stats were given that 6 to 10% of children are affected by ADHD. And they say that once a child is diagnosed, everyone in the family should be assessed, as they state it runs in families. So they put out this report that is saying we need to assess more and more children and surveil more and more children, plus their family members, if a child is diagnosed with ADHD. And now there's an explosion of ADHD, 6 months later. I wonder why.
Well, it's really interesting that you brought that up, because this particular information I got here and read actually was from a human rights, children's human rights, and it said that when they had tried to do this once before and it had failed due to a massive concern from the parents, but that they've done it in New Zealand or something, and since they did it in New Zealand, ADHD drugs have gone up 140% or something like that. So yeah, clearly an issue. Again, I want to talk a little bit about the ideology of it, because it seems to me we're constantly told, we need to be more tolerant, be a tolerant society. But when investment can be made from these problems, then arguably more problems must be identified, right, to keep your market. So what happens is it narrows what becomes acceptable, and it thus actually creates a less tolerant society, because what used to just be eccentricities or a lively child, or just differences of opinion, are now reframed as problems, and therefore, you've now prospected for a new customer, but you've made actually an unintended consequence perhaps, but you've actually made a less tolerant society.
Yeah, it's the pathologizing of pretty much everything, isn't it?
And then this is the last slide on it, and we've touched on it in the conversation that we've had. And it's the personal intervention versus policy interventions. Now, they'll argue that we're creating policy to fix it. No, you're creating an investment market to fix it. And what it does is there's no real focus on prevention via social determinants. And like you said, there's no real focus on what's being taught in the schools, only that children in the schools have got problems. It's an argument that policy is creating the issues in the social determinants of health and a healthy society, right? I think it's the policy that needs intervention, and the politicians. It's not the individuals. And we could go around this wheel, which are the social determinants of health and happiness and well-being and all those things. Every single one of them, the policy that exists coming out of Parliament and government actually increases every single one of them. We can just pick some. We can talk about health services at the top there, lack of access. Well, they've made things like NDIS so difficult to access. There's a whole new market in just getting help to access it. Another issue, that policy issue that they have, is that a number of healthcare workers have all been stood down because they're not vaccinated against COVID-19. Many of them are willing to go back into the workplace to help speed up, the provision of services. There's a massive backlog. That's just a straightforward policy decision. Let's go down to this green one at the right, social and spiritual environments. Well, many social clubs don't get the funding anymore. God is seen as something trite, and they're removing a lot of, theological and spiritual education out of the schools, and then that just increases loneliness, and then there's a whole lonely economy. We could go around to some other ones, education and literacy. I haven't touched upon it in this talk, otherwise it would be too long. Impact investing in the schools is huge. The measures in the schools are that there's fewer opportunities for achievement out of the education system that we have. Well, that's driven by policy. And yet then they have impact investments on and programs on how to get your self-employment ready after you finish school. Well, wasn't that school's job, right? So they're actually making things worse. Homelessness and housing instability, that's policy driven, right? There's all these things that could be fixed via policy. Oh, here we got psychological stress over on the right, health and well-being. When you haven't got a decent job, and when addictions are encouraged by setting up kind of drug rooms in the center of town, that's policy driving it. Over here on the left, employment and working conditions, precarious employment. Well, where's the policy to make sure that people have got a decent living wage? Where's the continue? They're moving towards the gig economy. There's a whole raft of things that it's clearly driven by policy that creates these problems, and yet the problem needs to be fixed at the individual level.
Yeah, and that's really real when you look at all of that. And I mean, even if you just look at because we've talked a bit more about the mental health aspect through this talk. Yeah, basically bringing it down, because we know that mental health is brought down to a very individualistic level, where it becomes about, you have to help yourself in some way through, I actually think it's incredibly trite, the stuff that's fed to people now, or you need to be medicated. So it's this it's this individual changing the human being, rather than looking at what is going on. I think that's pretty much what we've talked about through this whole time, and this is the flavour of what we're saying. There's no looking at it on a societal, country, global focus on what is going on in the world and why are things getting so much worse, and the pressure on children is so much intensifying that children actually need to be drugged to go to school. Why isn't that an absolute travesty that makes people go, what are we doing wrong here? We need to completely look at what's happening through the whole world.
Well, it seems to me that mental health, when we talk about mental health, we've traded security for safety. So, people feel fine when they're secure. When you're in a secure relationship, you've got secure parenting, you've got secure jobs, you can see a secure future for yourself. Then a lot of stress is lifted. But when all that security is taken away, and now everything is for your safety instead, well, then we're going to have mental health issues. And then the other thing I'd say is that many of these things come down to time and money. So if you think about loneliness, right? People are lonely because they either haven't got the time or the money to engage in things that stop you becoming lonely. So even nowadays, children's sport still requires money, right? Nothing is for free anymore. With both parents working all week, you don't have as much time to engage in, fun social activities on the weekend, even if you did have the money, because, you're busy doing the shopping or the washing or what have you. A decent job, decent, social clubs, all those things would create a better society, but that's not what's being created. What we're creating is an impact investing economy focusing purely on the problems of the individual.
And I think it's also very important to point out what you raised earlier in here, that the answers to the problems, according to them, is often more and more online. Get the kids into mental health apps, get increasingly online access to services or solutions for them online. So it takes it out of, kids being able to get out in the sunshine and run around and actually exercise and do things that are really good for them, into an online world, which then everything is data, isn't it? It's just data collection point once you're online.
Well, it does. And that's probably a good closing loop for the end of our discussion, because if we go right back to the beginning, to the slide wising up to the impact scam, he does say, total surveillance is required, and total surveillance means the internet. It goes back to that point right at the beginning. Many of the problems are being solved by putting things online, which actually then just feeds the data algorithms even more.
Yeah, good place to finish. And again, I think I said this in the first one, but it's really important, I think, for parents to start to understand what sort of surveys the children are being given at school and what data is being collected on their children at school, and to start to ask some questions around that, engage in it. But thank you so much, Tash. Thank you again. And we will come back, for another video and unpack another aspect of this in the future. Thanks for all your work and the information there.
Thank you, Kate. Really appreciate it.